So thanks for everybody, their participation in the breakout rooms. That flew by. I mean, that was a quick 20 minutes. So I understand that not everybody was able to get their questions in. And one important announcement I'd like to make is that anybody who's attended this event, who a registered attendee, you will get a follow-up email from AMFP that will have the email address and contact information for all the speakers, so that if you did not get a chance to get your question through, that you'll be able to follow up with them with an individual email. And so that'll be going out, and I just want to make sure everybody is aware of that. So, considering time constraint here, it looks like we get about maybe 6 or 7 minutes or so. And again, this kind of touches on a number of the questions that were posted, but I will kind of summarize it together so that the group can answer it. As we're calling this the new normal, right? So we're thinking that we're going to be dealing with not only this pandemic, maybe it becomes an endemic and then it continues on in some fashion, but the next one that comes, whether it's a few years down the road or next year. As you look ahead, what are you doing to get prepared for the next big pandemic, the next big spike, if it's different or just a continuation? And I'll just open it up to the group for your comments on that.
Well, I'll say one thing that we're looking at is a lot of how we all the materials that we needed to respond to these the different waves. So when we spin up prep recovery areas, we change them to ICUs, or a lot of the materials we needed for activating what was the ED triage, and then the ED overflow, and then testing, and then vaccine clinics. We use a lot of the same partitions and chairs and IV poles. So knowing where we can store some of them, where we can get some of those for rental and show up quick. So we're preparing for that in that type of way, for kind of just a quick ramp up. But then long term, it's definitely kind of looking at the mechanical systems and some of the planning to have those the types of spaces where people, if we need to, spread out or contract back in, we keep those things in mind, and some of those amenities that we've brought on board that have really led to patient and staff satisfaction. We'll keep an eye on those.
Mm-hmm. Thank you. Kurt?
Yeah, I think what we've learned, I think we can probably put into place a little quicker than what we did early on. I think, again, as we keep talking about space and we all struggle with being landlocked, and, unfortunately your building's your building, but I think we know we have space in our buildings that, again, as we start thinking, conference rooms, atriums, these spaces, if we can, again, I don't want to say no, but restrict access to those, we can ramp those things up quicker. I think early on, we didn't know how to use those spaces. And so I think as we look at whatever that next wave or whatever else will happen, I think we'll be thinking outside the box, maybe a little quicker. And that's probably even not the right words, because we reacted pretty quick, and not everything worked, but we reacted pretty quick with COVID too. But I keep going back to, I believe that healthcare continues to prove that it's very resilient as we see these pandemics. And I agree with what the panel has said multiple times, that, through our leadership, there's a lot of smart people working in healthcare and supporting healthcare. So I just believe in the system. I believe in what we have in all of our systems, that we just have redundancy, and we have very resilient systems here in our country.
Saliba?
Thank you. Just adding to what Ray and Kurt said, this, we cannot just depend on luck because it's not a pandemic strategy. I think we have to be prepared and plan for the future. You know, this pandemic is not really the worst. We have the much worse pandemics like the Spanish flu, where 100 million people died. I think we need to use our money smarter and spend money in the proper areas. There are some design things that I would like the engineers to look at. I mentioned at the break session that the UV lighting and cleaning of the patient rooms. One of the major issues we have is just to get rooms ready for patients that come from the ED. We have that Xenex machine that goes from one room to the other, that robotic machine. The housekeeper comes, he cleans up, and then we put the robotic for 15 minutes. Is there a way to design, patient rooms that have built-in UV machines that could be cleaned up? So imagine instead of having each one room takes 15 minutes, if you have a dozen rooms that they are ready to be cleaned, we could put these equipment in it. It's part of the design and the features of the room. Other thing, I think we need to keep the architects in mind to plan for surge capacity. We need to be able to have the medical gases there. I know over the years we have been switching from semi-private rooms to private rooms, but we want to be sure that we don't eliminate these head walls, keep them there, because with something like this, with a surge, we need to be able to handle these additional patients. Otherwise, we're going to be in trouble, especially if you are a hospital on your own, you're not part of the system, you cannot transfer patients. What do you do? So you want to be ready for that. And also keep in mind in the design and the future, the staff in mind, the respite areas that we discussed above them, the waiting areas, keep all that in mind, because planning all these upfront, I know it will cost more, but I think having the executive team involved and letting them know that this is part of emergency planning. And for me, I was lucky over the years. I've been on the emergency preparedness at the hospital. I've been the safety officer, so I had direct involvement with the CEO to convince him that we need these things. We need to spend the money. And when we built our ED, one of the pods, when we build it, we could totally isolate if the third pod in the ED. It has a separate entrance, so we could separate, COVID patients from the rest of the patients. So if you have COVID patients or other, so all these needs to be really well thought. I think we have very smart architects, engineers that they could do that for us. So there's a lot of things to be done, but I think we're on the right track. And I think there is a lot of opportunity to do after this experience to make things much easier for the future. As I said, this is not the worst pandemic. It is, we lost roughly 850,000, but compared to other pandemics, this is not the worst. So thank you.
Thanks, Saliba. So yeah, great feedback there. And this kind of shows the collaboration between the three of you represents really the collaboration that we've seen throughout the industry and between the different healthcare systems. So thanks again, Greg. I'm going to hand it back to you, and please, everyone, look for that email with contact information where you can reach out directly to the speakers. And Greg, it's all yours.
Okay. We're waiting for a slide. Okay, well, then that's no problem. We just wanted to say thank you to our speakers, Kurt Martz, Saliba Kokali, and Ray Lebrecht for taking their time out of their day to share their very unique perspectives. This is invaluable information to all of us in the industry, and we appreciate that. Just wanted to take one more opportunity to thank our sponsors. Without their help, none of this could be possible. So on behalf of AMFP Chicago, our sponsors, our guests, thank you to the audience for investing your time participating in this event. And we will see everyone hopefully in the April program. More information to come. Thank you.
Thanks.
Thank you.
Thanks, Greg. Good job.
Thank you, Greg, Steve.
Thank you all.
Yes.
Thank you,
Thanks
everybody.
very much.
Thank you very much.
See you soon.
See you.
See you, Saliba.
Take care, Robin. Good to
Yeah.
see you, Robin.
Likewise.
Nice job at the Elmhurst.
Hey,
Yeah.
thank you, gentlemen and ladies,
Thanks.
for
Okay.
joining us.
See you.
Thanks, Rob.
You got it. See ya.